what are the big successes in trigger point therapy?
In the last 10 years, there's been an explosion of studies. Randomized controlled studies are included in those. Others are observational studies because of the nature of what we're doing. Showing efficacy, relief of headache. I think it's remarkable.
Including migraine?
Migraine headache, the trigger point is one trigger among others. I can get, if I treat the trigger points in the head and neck, you can just stop a migraine within a few minutes. Pain in the knee after total knee replacement, Orlando Mayoral from Spain, very nice study, double-blinded study, showing that pre-treatment of the trigger points in the knee before total knee replacement led to a much faster decrease in elimination of pain post-operatively, post-stroke hemiplegia. There's even evidence showing that you can treat spasticity, post-stroke spasticity, or post-nervous system dysfunction spasticity with needling. So yes, the plantar fasciitis, many articles on plantar fasciitis treated with needling.
TMJ, I'm not sure if you mentioned
Oh,
that.
absolutely. Thank you for reminding temporal mandibular joint dysfunction.
Yeah.
Absolutely. But I think the point I would make is that realizing that you can treat effectively, you can treat the trigger point effectively. Treating the trigger point is part of a larger treatment of the whole person. So you have to look at why the trigger point was there, what is maintaining it, postural, occupational, recreational things, nutritional deficiencies, hypometabolic states like hypothyroidism, they all have to be addressed. And I think treatment of the trigger point answers the question about pain and allows to restore function. But then you have to do more than that to restore the patient to a full normal function back in the community.